A heart attack rarely happens in a hospital. It usually begins in a living room, a kitchen, or a quiet moment at home when no medical professional is nearby. And in those first minutes, the actions people take or fail to take can make a serious difference. Most people assume they will recognize a heart attack immediately. But in reality, the early signs can be confusing, subtle, and easy to dismiss. That delay is often the biggest problem. Understanding what to do before professional help arrives can help reduce panic, avoid common mistakes, and create safer conditions while waiting for emergency responders. Heart attacks often begin with symptoms that people misinterpret. Many imagine dramatic chest pain and collapse, but the real experience is often less obvious. Someone might feel pressure in the chest, discomfort in the arms, shortness of breath, nausea, dizziness, or unusual fatigue. Because these symptoms can appear gradually, people sometimes wait too long before taking action. They assume the feeling will pass, blame it on indigestion, or decide to rest and see if things improve. This hesitation is one of the most common problems during a heart attack at home. Another issue is uncertainty about what to do next. People may panic, move the person unnecessarily, or focus on the wrong actions while losing valuable time. Knowing a few clear steps can help bring structure to a chaotic moment. The first and most important step is to recognize the possibility of a heart attack and call emergency services immediately. Even if you are not completely certain, it is better to call for help than to wait. Emergency responders are trained to assess the situation and begin treatment quickly. When you call, stay calm and describe the symptoms clearly. Mention chest discomfort, breathing difficulty, arm pain, or any sudden physical changes you observe. Clear information helps responders prepare before they arrive. After calling for help, help the person sit down and rest in a comfortable position. A seated position with the back supported is often recommended because it can reduce strain on the heart and make breathing easier. Avoid having the person lie flat unless they feel faint or lose consciousness. Encourage them to remain as calm and still as possible. Physical activity can increase the heart's workload during this critical time. If the person is wearing tight clothing, such as a tight collar or belt, loosening it can help improve comfort and breathing. Another important step is to observe the person carefully. Pay attention to changes in breathing, skin color, level of consciousness, and speech. These details can help emergency responders understand how the situation developed. If the person becomes unresponsive or stops breathing normally, the situation becomes more urgent. In that case, emergency dispatchers may guide you through cardiopulmonary resuscitation, commonly known as CPR, until professional help arrives. Many people hesitate to begin CPR because they fear doing it incorrectly. However, in a situation where someone has stopped breathing or has no pulse, doing something is usually far better than doing nothing. Emergency operators are trained to guide callers step by step, so staying on the phone can be extremely helpful. Another helpful step is preparing the environment for the arrival of emergency responders. If possible, unlock the front door so responders can enter quickly. Clear obstacles near the entrance and create space around the person. These small preparations can save time during an emergency response. If medications are available, such as prescribed heart medication, having them nearby can also be helpful. Emergency responders may ask about the person's medical history or medications, so gathering that information in advance can make communication easier. However, avoid giving medications unless instructed by a medical professional or emergency dispatcher. It is also important to avoid certain common mistakes. Do not let the person drive themselves to the hospital. Driving during a heart attack can be extremely dangerous. Avoid offering food or drinks, especially if the person feels nauseated, and do not ignore symptoms simply because they appear mild at first. Heart attack symptoms can change quickly. Throughout the situation, your main role is to keep the person as calm and stable as possible while waiting for professional help. Sometimes the most helpful action is simply staying present, speaking calmly, and following instructions from emergency services. One key insight many people overlook is that preparation makes a huge difference. In an emergency, people rarely have time to research what to do. Stress makes it difficult to think clearly, and panic can lead to mistakes. But when someone already understands the basic steps, call for help, keep the person calm, observe symptoms, and prepare the environment, the situation becomes easier to manage. These steps do not replace medical care, but they create a safer bridge between the moment symptoms begin and the moment professionals take over. And that bridge can be extremely important. Heart attacks are medical emergencies, but they are also moments where simple awareness can improve response. Recognizing the signs, acting quickly, and avoiding common mistakes can help reduce confusion during a stressful situation. You don't need to be a medical professional to take useful action. Clear thinking and basic preparation can go a long way. If you found this explanation helpful and want to continue learning practical ways to handle medical emergencies at home, consider subscribing to the channel. Each video focuses on simple, realistic steps that help people understand how emergencies unfold and how to respond more effectively. You can also check the description below, where you'll find a useful resource that organizes the key warning signs and response steps discussed in this video so you can review them later and keep them accessible if you ever need them.